Next 30 seconds will change your life. Hey, Tushy team, it's Dr. Rosenfeld, your proctologist, your Tushy doc, and like an annoying relative, I'm back, but I'm not here to annoy you. I'm here to show you how to take your perfect poop raw psyllium fiber. So start with a little bit of orange juice, almond milk, oat milk, something with a flavor. Don't use water, it tastes bad, and you can choke on it. Right there on this beautiful cup is a 4-ounce fluid fill line. Put the juice or almond milk to that line. Take 1 level teaspoon of raw psyllium perfect poop fiber. Put it in with your juice, almond milk, oat milk, or whatever drink you have. Obviously put the lid on. Shake it quick, about 6 or 7 times, and then drink it quick. I do this every morning is my routine. If you're going to do it, drink it around the same time every day, whether it's morning or the evening. Just be consistent, and so good. Now, the fiber's in your stomach, but it needs water to really bind and work because it's like a sponge. So 4 ounces of a water chaser. As soon as you're done with the fiber and the orange juice or almond milk, shake the water, get the grit out, drink the water quickly, and so soothing. And as always, I love you in a very special way, the same way I know you love me. Hey, Tushy team, it's Dr. Rosenfeld, your proctologist, your Tushy doc. And like sticky stool, I'm back. Yeah, we're going to talk about fecal smearing, fecal seepage. That is not fecal incontinence. Fecal incontinence is when we lose our stool without any warning and we have no control. And it happens multiple times in a week, and it's not liquid, just liquid stool, it's solid stool as well. That's fecal incontinence. That's a muscle issue. That's not what we're going to talk about. We're talking about fecal smearing and fecal seepage. I have a lot of patients come in. I have men come in saying, "Doctor, I'm incontinent. I go to the bathroom, and then about an hour or two later, I feel something, and I've got this stain of brown stool in my underwear." And they think they're incontinent. And I have to explain to them that it's not incontinence. It's due to a stool consistency problem. The same thing happens with women. When the stool is mushy, sticky, it's hard to wipe. And no matter how hard we wipe, we can't get totally clean. I'm going to show you. And if you're eating, especially something chocolate, I'm so sorry, but here I have some chocolate fudge. And here's the anus, okay? Here's the outside of the anus. Here's putting a finger inside. And when your stool's sticky, oh, it's nasty. And then what you do is you have this sticky bowel movement that comes out and plops into the toilet, right? And that's what the anus looks like. And then you go to clean, and you wipe some more, and you wipe, and you get inside. You're putting it. You get your finger, and you're taking the baby wipe or your toilet paper because you're using a lot, and you're getting in there and you're cleaning out, and there's still stool there, and you wipe and you wipe, and you finally seem pretty clean, right? Well, let's look and see what happens on the inside. Oh, look what's on the inside. More stool. And like toothpaste in a toothpaste tube, if you leave the toothpaste tube open and on your counter, a little toothpaste is going to seep out. So your muscles are squeezing. Oh, look at that. A little bit more poop came out about an hour later. And guess what? You see this? This is your underwear. Okay? Let's get this straight. Here's your underwear. And when that stool seeps out, it's going to be looking like that. So that is like fudge, sticky stool, hard to clean as I'm doing right now. Yeah, difficult. So next we're going to talk about perfect poop. Long, solid, soft, and clean. Stool that comes out, and when you wipe, there's nothing there. In order to do that, we need more fiber. And I have vegans saying, oh, doctor, I'm a vegan. All I do is eat fiber. I'm like, yes, fruits, vegetables, and grains are great. They're great fiber. However, they don't congeal like psyllium does. This perfect poop is raw psyllium. It's vegan. It's gluten-free. And what psyllium does is it binds the stool, it congeals, and it makes it long and solid like clay. So here is a round ball. Let's make this into some perfect poop. Let's see the difference between that nasty fudge. Sorry if you're eating. You'll probably never eat chocolate cake again or chocolate fudge. So we're just going to bring this down and get it elongated so that we have a really good solid bowel movement. All right, Tushy team. Now, when this stool comes out and slides out and drops out as it should, you can wipe. What? You take your wipe and you wipe, and it's as clean as you started. And when you open up, there's nothing there because the whole thing came out in one volume. That is a perfect poop. When the stool is mushy, sticky, it comes out later, and then you're wiping or it gets in your underwear, and that's fecal smearing, fecal seepage. Totally different. So take psyllium every day. If your stools are still a little mushy, sticky, and you're taking psyllium, add a probiotic because most likely there's an imbalance of the bacteria, bacterial dysbiosis, or SIBO. We'll talk about those subjects at another time. But I will tell you, over 95% of my patients that come in with this problem will start on psyllium. I'll see them back in a month. Oh, their hemorrhoids are also enlarged too. And hemorrhoids, internal hemorrhoids that can come out and go back in, or the ones that are inside and big, what they do is secrete mucus, and that's a lubricant, so it allows stool to seep out even easier, and that makes it even worse. So I shrink the hemorrhoids in the office without any pain. I know painless hemorrhoid treatments. Yes, it exists. Come on in, and I can do it for you. It'll help. Add the psyllium. They come back in a month, and they say, problem solved. My underwear's white. Most people buy black or brown underwear now. But anyway, their underwear's white. They're feeling great. And as always, thank you for allowing me to educate. Today, educated on fecal smearing, fecal seepage. And please, pass this along. And thank you again for posting, reposting, liking, commenting, all that you do. And as always, I feel your love, and I love you in a very special way, the same way I know you are to love me. Hey Tushy team, it's Dr. Rosenfeld, your proctologist, your Tushy doc. And like a bad case of bleeding hemorrhoids, oh yeah, I'm back, but I'm not here to bleed or make you bleed or annoy you or make you squirm like hemorrhoids. I'm here to educate. So bleeding hemorrhoids. First, we're born with hemorrhoids. You can tell all your friends that you know they have hemorrhoids. Do you remember when you were in kindergarten and first grade and you said everybody, I see your epidermis is showing. It was like, oh, and they got all crazy. Well, epidermis is skin, and we all know we have skin. Well, guess what? We're born with hemorrhoids. We have a heart, lungs, kidney, spleen. We have those organs. They're encased in our chest and our abdomen, and we don't see them, but we know we have them. Hemorrhoids are venous cushions. They're like balloons, and we're going to talk about the internal hemorrhoids. So if this is the anus and this is putting a finger inside, internally we have these hemorrhoids, and like a balloon, this is a hemorrhoid, okay? And the hemorrhoids can live inside the anus or they can live outside the anus. Now, the internal ones are the ones with the soft lining, okay, and they bleed. And the reason they bleed is because when we're straining to go to the bathroom, we're putting pressure on the anus. And when you put pressure on and you're bearing down like this to go to the bathroom, hemorrhoid's getting bigger and it can pop. Now, why do we strain? Well, we strain when we're not getting enough fiber and we don't drink enough water and we have these rock hard stools. Here's my little handy bathroom. I have a toilet, in my office, just sitting right on my desk because every proctologist has one. And you're straining to go and all of a sudden this just rock drops out. Ooh, Michael Jordan, 1 for 1. Or you have all these little rabbit pellets because you're not getting enough fiber and you're sitting and you're just straining and you're just all red and up plop. 2 for 2. It was a 3-pointer. Now, when you have those little pellets, what's going to happen later is you're going to be sitting down, you'll feel something, and all of a sudden, boop, one comes out in your underwear. So that's one type of bowel movement where you're really straining. Another one is really bad is diarrhea. You go to the bathroom, and it's just water coming out. Oh, gross and disgusting. And what happens is when you have diarrhea like that, it doesn't come out like that. Typically, it's explosive. And you got to go, but you don't want to go in your underwear, so you're squeezing tight and you're running to get to the bathroom because you know it's going to squirt out in your underwear and you're going to have the Hershey squirts. It's nasty. So you're squeezing. And again, when you're squeezing, your hemorrhoid's getting bigger. Then you sit on the toilet and you just get this explosion of this nasty, like liquid molten lava coming out, and that'll really blow up your hemorrhoids. Then another type of bowel movement that's not great for us is the mushy, sticky stool. So here's a little chocolate fudge. And you go to the bathroom, and it's just sticky, and you're just shaking to get it out because it won't come out, and you're just shaking. You're doing that little dance, and you're doing dance, and up, there it comes, and it drops in the bowl. And what's inside? More sticky stool, and it comes out, and you're just sitting there squeezing to get it out. And what happens when you squeeze? You're pumping your hemorrhoids full of blood. Another bad bowel movement. What we want is we want the perfect poop. This, not quite yet, is the perfect poop. We're going to roll it up for you, Tushy team. We're going to make some perfect poop. Oh, and by the way, so after you go to the bathroom and you have that liquid molten diarrhea, you have that mushy, sticky stool where you're squeezing, and you have rock pellets coming out. After that, you get this dripping of blood. Just drip. And by the way, everything I'm using has to do with food. This is food coloring. That was chocolate fudge. And then when you look in your hand, when you look inside the anus, there's blood inside the anus. And of course, after that, when you wipe, you see blood on the toilet paper. So that's what happens. Also, when your stool comes by, your hemorrhoids can be bleeding. And when a regular stool comes by, it can coat the stool because the blood's painting it. But let's look at that normal bowel movement, because if we want to prevent those hemorrhoids, we want a bowel movement that comes out where we're just sitting on the toilet naturally, and it just slides out. So, okay, Tushy team, here's some clay. This is not food. Don't eat this clay. The frosting you can eat, which you'll probably never eat again. That was chocolate frosting, chocolate cake, cupcakes, all those things you eat chocolate frosting with, a little bit of red food coloring. And now here we have like the perfect poop. And it's going to come down smooth and easy, and it's just going to drop out. I don't want to drop it in there because it's all disgusting. I don't want to get this disgusting, but it just slides out nice and smooth and easy. Boom. And what do you see on the inside? Nothing. And when you wipe, clean, nothing there. That's the perfect poop, okay? So when we have a perfect poop like that, and we're not straining, your hemorrhoids will get smaller. I just had a patient today that had like a year of just hemorrhoids bleeding. No pain, by the way. Internal hemorrhoids have no nerve endings. They're the ones on the inside. They can come out and go back in. When they're out, they get squeezed and they can stream blood into the bowl, kind of like that, because they're getting squeezed like the udder of a cow and they're just spraying into the bowl, and it's nasty, and people think they're bleeding to death, but that won't happen. I had a patient tell me she started on Perfect Poop psyllium fiber. Hold on. Here it is. She started on this. It's a product. You could find it on my site in the link pop. She started on that. She started having regular bowel movements just like this, no straining, just dropping out. And she said immediately the bleeding got much better. But recently with some constipation, her hemorrhoids were swelling and she got a thrombosed hemorrhoid. She started bleeding a little bit. So I shrunk her hemorrhoids in the office today without any pain. This little rock pellet stool, this rock pellet stool, the liquid stool, the mushy sticky stool, straining, all bad for hemorrhoids. All put more pressure in the anus, which pump these hemorrhoids full of blood, like that. And then when it pops, blood leaks out. Okay, when we have a regular bowel movement, it's just, you're just sitting there and it just drops out. And you're clean. And that will decrease hemorrhoid size. That'll make it less likely that you have bleeding. If you still have bleeding and you're still having symptoms, maybe they're still coming out called prolapse and going back in, come see a proctologist, a tushy doctor like me. And in the office, I can treat your hemorrhoids without any pain, get them to come back inside, hold tight, and then no bleeding for 6 months to a year. Thank you, as always, for letting me educate, not only about hemorrhoids and poop, but about food and what I use to make poop. Thank you for all your likes, comments. Thank you for sharing and reposting. And as always, I feel your love. I appreciate your love. And I love you in a very special way, the same way I know you already love me. Let me flush. Hey, Tushy team. It's Dr. Rosenfeld, your proctologist, your Tushy doc. And like thin stool, I'm back. Yeah, thin stool. That was a question someone asked. What about pencil thin stool? I was talking about statistics of young people younger than 50 getting colorectal cancer. In 2023, about 20,000 young people died of colorectal cancer. I was about 13% of all patients were young patients, and that's really a crime. So thin stool, let's first talk about the colon. Let's talk about stool itself. Stool is the waste that we don't digest, and it goes through the colon. And the colon diameter, the lumen, can be pretty big. It can get bigger than this. And when your colon is normal and it can stretch, this big stool, regular stool that looks like this is a normal bowel movement, can just slide through. And the colon works in a hand-over-hand squeezing fashion. So if this was a long tube, it squeezes like this to push the stool out. So it grabs it and it pushes it through, and it grabs it and it pushes it through, and it just keeps doing this until it goes along. Now, when you get a mass in your colon, when you have a little polyp that continues to grow and turns into a cancer, that cancer is going to take over the lumen. So here's normal, and here's a cancer. And right in the middle is that little hole. And if you have that small hole, then just like this small hole, when you start to have stool, it comes out pencil thin, like this. So if your stool is pencil thin versus a log, a normal bowel movement, it means that there could be a blockage in your colon. Now, many times, stool like that could be from lack of fiber. If we don't get enough fiber in our diet, drink enough water, our stools can be rock pellet-like, they can be hard, or they can be long and thin. So even if you were to add fiber and your bowel movements change, you are definitely a candidate for colonoscopy because there could be a blockage in your colon. That normally would be a cancer. I don't want to alarm everybody who has thinner stool. I mean, we're talking about pencil thin, really, really thin like that. And again, it is kind of like a clay machine where the smaller the lumen, the smaller the opening, and the bigger the lumen, the bigger the opening and the bigger the bowel movement. So pencil thin stool is a concern. For me, if someone comes in with those symptoms, I would definitely schedule a colonoscopy with that patient and make sure everything is okay, even if adding a fiber like psyllium fiber would help. So as always, thank you for your comments and questions. Thank you for letting me educate. Thank you for reposting and sharing. Please repost this. People need to know about their stool, what it looks like, and what to be concerned about, and when to get a colonoscopy. And as always, I appreciate your love, and I love you in a very special way, the same way I know you already love me.